Okay, so for the second diagram, it's about the hypothalamus and the pituitary gland. The hypothalamus generates an hormone called gonadotropin and also hormone GnRH. It produces, of course, in the hypothalamus, and it stimulates the anterior pituitary gland to release gonadotropins, LH and FSH here. And it's controlled by feedback from the testosterone and inhibin levels. Here, it's all in the brain, in this part of the brain. And the anterior pituitary gland releases the luteinizing hormone. It's secreted, of course, by this gland, and it stimulates the Leydig cells in the test to produce testosterone, of course. And the follicle-stimulating hormone, it's also secreted by the anterior pituitary and stimulates the Sertoli cells in the seminiferous tubules to support the spermatogenesis and secrete inhibin. And the hypothalamus secretes in the GnRH in a pulsatile manner to stimulate the pituitary gland, and it's all regulated by this tiny part of our brain, and this is how it looks like.
The sperm from the testicles travels through a little tube called the vas deferens, which the vas deferens starts in the testicles. It goes into the urinary bladder. From the urinary bladder, it goes down to the prostate. Once it reaches the prostate, it's going to keep going down until it reaches the length size of the penis and the urethra, which is the little opening in between the penis.
Now I'm going to talk about how to use the different methods of birth control and how they work to prevent pregnancy. I'm going to point which birth control methods are effective at preventing the spread of sexually transmitted disease. First, barrier methods. These methods physically block sperm from reaching the egg, and these one are the condoms, the male and the female. How it works: a male condom is worn over the penis, while a female condom is worn inside the vagina. Both create a barrier that prevents sperm from entering the uterus. The effectiveness for pregnancy: condoms are about 85 to 98% effective when used correctly. The STD prevention is that condoms are highly effective at preventing the spread of sexually transmitted disease like HIV, gonorrhea, and chlamydia. The diaphragm. How it works: a diaphragm is a dome-shaped device inserted into the vagina, covering the cervix to block sperm from entering the uterus. The effectiveness for pregnancy is that when used with spermicide, diaphragms are about 88% effective. The STD prevention does not protect against the STDs. The hormonal methods. Now, hormonal birth control methods alter the body's hormone levels to prevent pregnancy. This one can be the birth control pills, the implant, or the injection. The birth control pills are pills that contain hormones, estrogen or progestin, that prevent ovulation, thicken cervical mucus, and thin the uterine lining. The effectiveness for pregnancy is that when used correctly, birth control pills are about 99% effective, but typical use is about 91% effective. The STD prevention is that it does not protect against STDs. The implant. How it works: a small rod inserted under the skin of the upper arm releases hormones that prevent ovulation and thicken cervical mucus. The effectiveness for pregnancy is about 99% effective. The STD prevention is that does not protect against STDs. Now the injection. How it works: a hormonal injection given every 3 months that prevents ovulation and thickness cervical mucus. The effectiveness for pregnancy is about 94 to 99 effective, and it does not protect against STDs. Now, the intrauterine devices, or the UTs. These are small teeth-shaped devices inserted into the uterus by a healthcare provider, and there are two types: copper UT and hormonal UT. The copper UT releases copper ions that are toxic to sperm, preventing fertilization. The effectiveness for pregnancy is about 99% effective, and it does not protect against STDs. Now, the hormonal UT releases hormones that prevent sperm from reaching the egg, thicken cervical mucus, and thin the uterine lining. The effectiveness is about 99% effective, and it does not protect against STDs. Now we are going to talk about the permanent methods. These methods are intended for individuals who do not wish to have children in the future, like sterilization with tubal ligation or vasectomy. The tubal ligation involves cutting or blocking the fallopian tubes in women, while a vasectomy involves cutting or blocking the vas deferens in men. Both prevent sperms and egg from meeting. The effectiveness for pregnancy is about 99% effective, and it does not protect against STDs. Lastly, the natural methods. These methods do not involve physical devices or hormones, but rely on understanding and tracking fertility. The fertility awareness. How it works. It involves tracking ovulation to avoid unprotected sex during the fertile window. The effectiveness for pregnancy is about 76% to 88% effective. It does not protect against STD. And lastly, the withdrawal pull-out method. The man withdraws before ejaculation to avoid sperm entering the vagina. The effectiveness for pregnancy is about 78% effective, and it does not protect against STDs.
The organs of the female reproductive system are divided into internal and external. In the internals, it contains the ovaries, which are paired almond-shaped organs located on either side of the uterus, and their function is to produce oocytes or the eggs during oogenesis, and it secretes hormones including estrogen and progesterone. The fallopian tubes are narrow tubes that connect the ovaries to the uterus, divided into sections: the infundibulum, the ampulla, and the isthmus. Its function is to transport the oocyte from the ovary to the uterus and provides the site for fertilization. The uterus, which is a muscular pear-shaped organ divided into the fundus, the top, the body, the main portion, and the cervix, which is the lower or narrow portion. It supports and nourishes a fertilized egg during pregnancy, and it facilitates implantation of the embryo in the endometrium. The vagina, which is a muscular elastic canal extending from the cervix to the external genitalia, and it works as the birth canal during delivery, and it also receives the penis during intercourse and serves as a passage for menstrual flow. The external organs are the vulva, which is divided into labia majora, which is the outer folds of skin containing adipose tissue and sebaceous glands. It protects the internal reproductive structures. The labia minora is a thin inner fold of skin which encloses and protects the vaginal and urethral openings. The clitoris, which is a small erectile tissue located at the anterior junction of the labia minora, and it provides sexual arousal. The mons pubis, which is the fatty tissue covering the pubic bone, and it provides cushioning during intercourse. And the vestibule, the area between the labia minora containing the openings of the vagina and urethra. It contains glands that provide lubrication. The oocytes are produced in the ovaries during oogenesis. During ovulation, they are released from the ovary into the fallopian tube, which sweeps the oocyte into the infundibulum and moves through the fallopian tube via ciliary movement and peristalsis. When pregnancy occurs, the fertilization typically occurs in the ampulla of the fallopian tube. Sperms penetrate the oocyte to form a zygote. The zygote travels to the uterus where it implants in the endometrium about 5 to 7 days after fertilization. The hormonal regulation of the female reproductive system, it starts in the hypothalamus, which segregates gonadotropin-releasing hormone, which stimulates the anterior pituitary gland to release gonadotropins. In the anterior pituitary gland, it creates follicle-stimulating hormone, which promotes estrogen production in the follicular base and stimulates growth and maturation of ovarian follicles, and luteinizing hormone, which triggers ovulation and stimulates the formation of the corpus luteum, which produces progesterone. In the ovary, it produces estrogen, which stimulates the growth of the endometrium in the uterine circle, and progesterone, which is produced by the corpus luteum and prepares and maintains the endometrium for potential implantation. The ovarian cycle is divided into three phases. The follicular phase from the day 1 to 14, in which FSH hormone stimulates the growth of several follicles with one becoming dominant. The dominant follicle secretes increasing level of estrogen, which triggers a surge of LH. Rising estrogen levels inhibit FSH and stimulate LH release. The last phase of the ovarian cycle is the luteal phase, on day 15 to 28. In this phase, the ruptured follicles form the corpus luteum, which secretes progesterone and some estrogen. If fertilization doesn't occur, the corpus luteum degenerates into corpus albicans. The progesterone level dominates, inhibit GnRH, FSH, and LH to prevent further ovulation. On the other hand, we have the uterine cycle, which corresponds to the changes in the endometrium and is divided into three phases. The menstrual phase starts from the day 1 to the day 5, and it starts in the shedding of the endometrial lining due to the drop in progesterone and estrogen levels. The low levels of progesterone and estrogen triggers menstruation. The second phase is the proliferative active phase, from the day 6 to the day 14. In this one, the estrogen from the developing follicles stimulates the regrowth of the endometrium, and the rising estrogen levels rebuild the uterine lining. On the secretory phase, the third and last phase, the progesterone from the corpus luteum prepares the endometrium for the implantation by increasing its thickness and vascularity. If no applications occur, hormone levels drop, leading to the next menstrual phase. The ovarian cycle influences the uterine cycle. For example, in the follicular phase in the ovarian cycle correlates with the menstrual and proliferative phase in the uterine cycle, driven by the rising estrogen levels. But it also in the luteal phase of the ovarian cycle aligns with the secretory phase of the uterine cycle dominated by progesterone.